Hi there, Dr. Norris Goldberg, and I am the owner and clinical director here at Koru Chiropractic Corrective Care. And today I want to talk to you a little bit about spondylolisthesis, but in particular, retrospondylolisthesis. A retrospondylolisthesis is a little different than other. Spondylolisthesis kind of insinuates that there is same degeneration and displacement of the vertebrae in relation to the one above or below, right? And so sometimes they're called anterior listhesis because it moves forward, and sometimes it's a retrolisthesis because it's moving backwards, okay? So today, again, I'm going to be talking about the retrolisthesis because both anterior and retro can be benefited through specific and gentle chiropractic care, but they're treated in very different ways, okay? And so I had an amazing case recently where I had a very severe retrolisthesis to the point where if you were to ask a medical doctor what it is, they would actually agree that is called a subluxation because that bone was nearly dislocated off of the spine. And I'm going to show you a picture here where you can see that L5 is moving posterior to the base of the spine, the sacrum, and it's actually posterior to L4 as well. And what we did was some very unique but specific adjustments to this gentleman to literally relocate that bone into his spine, right? And this is a really severe example. They don't usually look this bad. And so the change right here with this gentleman, as you can see in the photo, was nearly miraculous in terms of how much his spine changed and improved. It changed the angulation of the base of his spine, his sacrum. That's where the entire lumbar spine sits. And it really moved L5 forward, which was great because what happened in his case, you can see with this model here, when this vertebrae moves back, it really creates a shear force against the disc and compresses on that nerve right there. And so in his case, it really actually creates a stenosis effect, closing of the pathway here that the spinal cord is going to be going down. And so the gentleman here who was experiencing this had bilateral numbness and tingling all the way down to the balls of his feet, okay? And that's an unusual presentation. It's a stenosis presentation versus like a radicular impingement, right? Like if you have a disc bulge on one side, you'll have nerve pain to a very specific spot, like your big toe, right? But when it's a compression of the whole spinal cord, you can have nerve pain diffusely across both legs at the same time. And you won't find usually individual patterns of pain like just to the big toe. Now, in some cases, this is a medical emergency. And I always advise my patients, if this is something that we're treating, that we need to take this very seriously because if it were to go sideways or if a patient weren't to respond well to an adjustment, it would be a sign that there's some significant instability in the spine. But what I do is I, really try to, mitigate my risks as a doctor by looking at the motion of the spine. And what we can see when we're looking at the motion of the lumbar vertebra is when people do side bending, lateral flexion, and we do this under imaging or x-ray, we can see if the bone is stable, if it is, we also do flexion extension, so we can see if it's really just in an unhealthy way sliding around in there, or if it seems like it's something that could withstand an adjustment, okay? And so this is something we've had success with in this practice, and we've had people who have been able to avoid surgeries, who had literally been scheduled for surgery because that was the only option they thought they had left. And we've had other people who have had surgeries, and then because of the degenerative process of getting your spine fused, they start to get a retrolisthesis near the site of fusion, but not directly on it. So it means that we can treat it, we can adjust it safely, and get people feeling a lot better, right? And so again, how we fix this issue is specifically through adjustments to the spine. We get those bones back into the proper alignment there, so these joints are a lot happier. The facet joints, the disc doesn't have all this shear tension through it, which causes advanced degeneration. And again, this can already, usually when this is happening, there already is disc degeneration accompanied with it, maybe even facet degeneration, and hopefully not, but possible body collapse, okay? And so that's part of the process when someone comes into the practice, is we're doing a very, very thorough neurostructural assessment to evaluate where the problems are, and then also making sure, of course, it's safe to adjust. And if it is, how is it positively influencing the nervous system and the function of the nervous system? So not just getting you out of pain in the short term, but ultimately getting you functioning and feeling better in the long term. So that's what we focus on here at Koru Chiropractic. And if you yourself are struggling with pain from a retrolisthesis, or you've been told or diagnosed with a spondylolisthesis and would like to come in and get an evaluation to see if chiropractic care could specifically help you, I would love to consult with you. Give us a call.